The failure of public health in America is both purposeful and for profit. My name is Alan Roberts. Check out the links in the pinned comment below, description box below, the bio above for links to our New Year specials for our coaching. That's where my wife and I talk to people via our app in a private chat on a daily basis with weekly video conference calls. We help a person adjust their lifestyle bit by bit. We focus on satiation, satisfaction, appropriate fitness level activity. We help build habits around hydration, stress relief, sleep, nutrition. This way, the person never feels like they're on a diet when they lose weight. And that way, when they are done losing weight, they don't regain because it's just their new lifestyle. If you have yo-yo dieted before, make 2023 the year you get healthy for good. We look forward to working with you. Links everywhere I said. Now, I wanted to talk today about the failure of public health in America, because it has failed in many regards, and especially in the last couple of years, but it has been failing us for quite a while. And the evidence of this is literally on their own data. We literally have an organization in America called the Center for Disease Control and Prevention. According to their data, we spend $4.1 trillion a year on healthcare burden in the United States. That, is, by the way, is $4.1 trillion in revenue for pharmaceutical companies and healthcare companies. Just to be very open and front about it. We need to start seeing it that way. It is their revenue. It is our expense, their revenue. And the CDC, by their own data, clearly knows that 90% of that is spent on mental illness and chronic illness. And the data has been known for a long time that 90% of all type 2 diabetes, 80% of all cardiovascular disease, 70% of all cases of cancer and stroke are preventable with lifestyle changes. We absolutely know that heart disease, diabetes, stroke, cancer are the leading causes of death in America, and about 75%, if you do the average, of that is avoidable. So not only we're not even talking about the burden, we'll get to the money here in a second, but they know that about 75% of the deaths from all chronic illness are avoidable by lifestyle change. When we lose people to a younger age due to diabetes, due to chronic illness of some kind, they know that for the most part, it's about 75% avoidable. They know that the burden of this is anywhere from 75% to 80% avoidable. So if you take $4.1 trillion, and by their own numbers, they know 90% of this is from chronic illness and mental illness, and then you take 75% of that, it comes up to $2.7 trillion plus that could be avoided for revenue for pharmaceuticals, but burden taken off of the people of America. One must ask themselves, since they know this information and they know all the data, we should be asking ourselves why, in fact, they are not pushing for lifestyle changes and lifestyle mitigations, why our government is not helping us to avoid illness. We have a sick care system in America. We do not have a health care system. The entire system, in my opinion, of course, needs dismantled and rebuilt on a preventative model versus a treatment model, because the very first thing we go to in our society today in America is pharmaceutical and surgical intervention, when the last thing we should do should be pharmaceutical and surgical. People should try their very best to avoid illness and to, in fact, recover from illness and disease through lifestyle change as much as possible, because it is better for the person and it is better for our society. The burden on our healthcare system was something we were so concerned about over the last couple of years that we, in fact, closed down portions of our economy to protect the healthcare system from being overloaded from burden, when we know that a huge portion of this burden, they know that a huge portion of this burden was from lifestyle-driven chronic illnesses. Preventable lifestyle-driven chronic illnesses. And even in the face of that, we did not in any way encourage people to try to be healthier, to eat better, to sleep better, to get proper hydration, to get out in the sun so they could get proper vitamin D levels. We did not try this at all. Therefore, it is not ignorance. It is not that they just don't realize it. It is, in fact, that it is purposeful to keep generating this amount of burden for the people and profit for these companies. There's not any other way to explain it away. There's not in any other way a logical deduction that these people know that we spend this much money and have this much death from these avoidable lifestyle-driven chronic illnesses, and also know that through lifestyle change, not being obese, not smoking, drinking in moderation, if at all, would help prevent 75% of the healthcare burden that we have in our society. That money could be used for so much more to unburden the people. But instead, that revenue still goes to pharmaceutical industries. That revenue still goes to healthcare industries instead of us trying to spend that money on ourselves to better our own health. Instead of helping you avoid the pain, illness, and early death that is, associated with just about every poor lifestyle decision, we instead just try to treat it. They make it seem like it's not a big deal. They make it seem like there's no big deal with being obese, when in fact, being obese leads to cardiovascular disease, type 2 diabetes. It is known. These things are absolutely known. They know this and they have known this. But they are not trying to push for people to lose weight through lifestyle change. Instead, we are starting to see lots of push for things like Ozempic and Wegovy and other weight loss drugs to help deal with weight loss and type 2 diabetes without really changing the lifestyle. But if we just had lifestyle mitigations, if we avoided ultra-processed foods, which has been shown recently, and I've done videos about this, which have been shown recently to literally have negative effects on the executive function of someone's brain by a huge number, 25% reduction in the executive functions of someone's brain after they've ingested 20% or more ultra-processed foods for between 6 to 10 years. They know this. They absolutely have no doubt. The data is irrefutable. And instead of debating, if they don't believe it, we could debate the data, because that is actual science, people. Science is actually debating back and forth about the data that is presented. It is not one side just decides what the data says. It is the actual challenging and constant challenging of the data. So I do challenge everybody to start thinking about why we don't talk about trying to avoid diabetes or avoid cardiovascular disease or to avoid cancers. 13 different types of cancers are more prevalent with obesity than even smoking. We don't try to avoid these things or warn people about these things. Instead, our public health officials, who are funded by us and pharmaceutical industries and hospital industries like the CDC and the FDA, do take money from large pharmaceutical companies that I'm not going to mention in this video because I want this video to be seen by many. But we must understand that this is not just a big mistake and failing of the public health industry or our public health officials, because if it is not purposeful, it is an absolute abject failure that obesity rates have skyrocketed in the last 10 years, and it's an abject failure that we in fact aren't addressing it. But we should realize that it is both purposeful and for profit. God damn. My name is Alan Roberts. I'm a best-selling weight loss author and weight loss coach. I've joined forces with the Ambrosia Collective to produce No Morbidity. It is the first of its kind, non-stimulant, non-thermogenic-based appetite suppressant made up of 4 patented ingredients at their clinically tested doses. We have put this together to help people gain control of their lifestyles, to gain people control of their habits in order so they can get to a healthy weight and remain there. We have a world to save. Go to ambrosiacollective.com or tigerfitness.com and get you No Morbidity right now. At a price point of $39.99, this will pay for itself in food you save, as well as save your future health.